Another new study is raising safety concerns about a common low-calorie sweetener and how it could be worse for your heart than sugar.
Our 9 Health expert, Dr. Payal Kohli, is joining us this morning to break down the study. Good morning.
Good morning.
So this study is really interesting. It compared erythritol and sugar. So first, what is erythritol and where do you find it?
Yeah, so erythritol is a fermented sugar. It's an alcohol sugar. It naturally occurs in our body. So scientists thought, well, why not turn this into an artificial sweetener? Because if it's a naturally occurring substance, maybe it's safer than sugar. And for the longest time, the FDA said, yeah, it's probably generally considered safe. But now we have this emerging body of data that suggests that it may not be so safe. So if you think about where it's found in fruits like pears and grapes and watermelons. It's found in beers and wine. It's found in jams and jellies, baked goods. Think anything like chewing gum or low-calorie mints or anything like that likely has erythritol in it. Stevia, which is a popular sweetener, also has erythritol in it.
Yeah, so what exactly, when it comes to maybe this being kind of dangerous, did the study find?
So this is the first time we're comparing this head-to-head with sugar, because we've thought for the longest time reaching for artificial sweeteners over sugar is the safer way to go. So that was really very interesting that the scientists did it sort of a head-to-head comparison, but it was only 10 people in each arm. But what they did is they had them fast overnight and then drink 30 grams of erythritol or 30 grams of sugar. Oh. And then they checked their blood to see how sticky their platelets got. Platelets are these clotting cells in our blood that are linked to heart attacks, strokes, and all kinds of cardiovascular problems. So the ones that drank sugar, interestingly, didn't have an increase in platelet reactivity or stickiness, and these are healthy volunteers, not diabetics, remember that. But the ones that drank erythritol had a 1,000-fold increase in their blood erythritol levels, which made those platelets clump together and stick together.
Interesting.
Yeah. It is. Talk about why erythritol might not be listed on those nutritional labels.
So here's the tricky thing, right? You can say, okay, well, I'll just avoid the erythritol, but it's often hidden. So a lot of times the FDA has not regulated this that strictly. They'll just write sugar alcohol in there. You don't know that it's erythritol. Sometimes it's a proprietary artificial sweetener, so they don't actually say what the components of it are. Sometimes it's a concentration issue. If there's not a lot of it, they might not list it in there. So it can sneak into our foods, anything that's really artificially sweetened, without us really sort of realizing it.
So what does the FDA say about artificial sweeteners then?
They say usually generally safe, but I think this new body of research with this study earlier last year that told us that maybe more heart attacks and strokes, and now this is a follow-up study from the same group explaining why they might be having more heart attacks and strokes if they're causing more clotting, says that they might be higher risk. Now, the carcinogenic signals have not emerged. I know we've talked a lot about whether or not artificial sweeteners cause cancer. Yeah. That really hasn't sort of panned out. But I have to say we need more studies before I start to tell my patients to think about using artificial sweeteners.
I think it's interesting because, you know, some people may be different in terms of like diabetics, right? They look for some different types of sweeteners and sugars for that as well. So what is your advice for someone that's looking for those artificial sweeteners? Yeah,
so if you're a diabetic or healthy, I would say, first of all, sugar is poison, okay? More so for diabetics than for healthy people, but we know that large amounts of sugar can cause platelets to stick together. They can cause cardiovascular disease, heart attacks, strokes. You really want to cut down the amount of sugar in your diet, no matter what. Now, if you're thinking of an alternative, in low amounts, perhaps some of these artificial sweeteners for healthy people might be reasonable. But if you're diabetic, have heart disease, have chronic kidney disease, don't think you're being healthy by reaching for them, because more and more this research is telling us that perhaps they're not as safe.
So really, just briefly, your recommendation is almost, if you can, try to cut that sugar out altogether.
Cut it down. Oh. And it takes your taste buds a few weeks to adjust. And unfortunately, what happens as we age is we need our receptors sort of don't work as well, so we need more sugar to get that same kind of hit. But if you can gaslight your brain into cutting down the sugar, it's going to make you live longer and live healthier, which are the two things that all of us really want to do.
Yeah. All right, Dr. Kohli, thank you as always. You can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.